Classifications. Therapeutic class, broad purpose of drug, antihypertensive is used for HTN. Pharmacologic class, specific pharmacological approach within the therapeutic class, beta blocker, calcium channel blocker, etc. Are within the antihypertensive therapeutic class. Generic name, actual name of the drug amlodipine. Trade name, the name that the drug is marketed under, several different ways to name the generic drug, Norvasc. FDA pregnancy categories. Good studies show no risk of fetal abnormalities, good human research, no risk. Safe in animals but not adequate enough studies in humans, or adverse effect in animal studies but human studies do not show increased risk, safe in animals but no studies in humans or no harm in humans. Adverse effect in animals but no good studies in humans or no animal studies and no human studies, no evidence of good or bad in humans. Risk to fetus but benefits may outweigh risk, evidence of harm in humans. Causes fetal abnormalities, should not be used during pregnancy.
Routes of administration. Enteral, through GI tract. Tablets, capsules. Some can be enteric-coated, prevents digestion by stomach acids. Sublingual, buccal. Drug goes directly into blood due to amount of blood vessels in area 3. Nasogastric, gastric G2. Topical, applied to intended site of action, transdermal, ophthalmic, otic, nasal, respiratory. Administered via inhalation, vaginal or rectal. Suppositories, ointments, creams, gels, for irritation or infection. Parenteral, involves needles penetrating skin. Intradermal, rapid absorption due to vasculature. Local anesthetics or allergy testing. Subcutaneous, insulin, heparin, vaccines. No more than 1 ml to be injected. Intramuscular, faster than ID or SC. Proper landmarking needed. No more than 3 ml to be injected. Intravenous, very rapid onset. Continuous infusion, intermittent infusion for push. Pharmacokinetics, absorption, distribution, metabolism, excretion. Oral, stomach, small intestine, absorbed, carried by portal vein, blood supply, liver, primary site of metabolism in body. 2 possibilities. Systemic circulation, tissue, heart, brain, muscle, kidney. Excretion, biliary, gallbladder, bile ducts, small, large intestines, excretion, feces. Parenteral, other routes directly absorbed into systemic circulation. 2 possibilities. Systemic circulation, tissue, heart, brain, muscle, kidney. Excretion, biliary, gallbladder, bile ducts, small, large intestines, excretion, feces. Adverse effects. Unintended and undesired responses from drugs. Side effects. Secondary to main therapeutic effect of drug and are expected. Often occur at normal doses and are often unavoidable. Often due to poor specificity, selectivity of drug.
Antihistamines block H1 histamine receptors, preventing allergy symptoms, runny nose, watery eyes. Side effects include drowsiness, dry mouth, and urinary retention. Drug toxicity, any severe adverse drug event. Often mediated by overdose. Reactions are often extensions of therapeutic effect. Patient taking too much insulin equals hypoglycemia. Allergic reactions, mediated by immune system. Requires prior sensitization where patient is exposed to allergen, drug. Upon subsequent exposure, an allergic reaction occurs. Mast cells release chemical mediators such as histamine. Reactions can vary from itching rash to life-threatening anaphylaxis, bronchospasm, edema, and severe hypertension. Intensity is independent of dosage size. Small dose can produce severe allergy. Idiosyncratic reaction, reactions that occur rarely and unpredictably. Genetic polymorphisms account for majority of idiosyncratic reactions. Examples of genetic polymorphisms that cause idiosyncratic reactions. CYP to C9, polymorphism decreasing metabolism, 15%, Caucasians. CYP to D6, poor metabolizers, 10%, African American, Caucasian. Patients do not experience pain relief when taking codeine, drug metabolized by CYP to D6, morphine. Glucose 6-phosphate dehydrogenase deficiency, G6-PDH, enzyme important in red blood cell metabolism. Deficiency common in African, Middle Eastern. Patients with deficiency may have red blood cell hemolysis with certain analgesics, aspirin, or antimalarial drugs. Carcinogenic effects, ability of a drug to cause cancer. Few drugs are carcinogenic. Diethylstilbestrol, DES, used to be given to prevent spontaneous abortion, is high-risk pregnancies. Years later, female offspring equal vaginal, uterine cancer. Mutagenic effects, changes DNA and often carcinogenic or teratogenic. Drugs that aren't carcinogenic or teratogenic may receive approval for use from regulatory agencies if there is sufficient evidence of safety from preclinical studies. Teratogenic effects produce birth defects or impair fertility. Defects include behavioral and metabolic defects. Sensitivity to teratogens changes during development. Gross malformation typically occurs in the first trimester. Exposure during second and third trimesters usually disrupts function as opposed to gross anatomy. Drug transfer across placenta is greatest in third trimester. Surface area for transfer between maternal and fetal circulation increases as placenta develops.
Main neurotransmitters to know. Acetylcholine, ACH, found throughout nervous system. Sends plus received information between the motor neurons and voluntary muscles you have conscious control over. Every movement you make depends on the release of ACH from your motor neurons to your muscles. Dopamine, DA, used by neurons to make voluntary movements plus movements in response to emotion. Also plays role in pleasure, reward system in brain. Also crucial in focus plus memory. Norepinephrine, NE, regulates mood plus arousal, known as the stress hormone, used in fight or flight. Northeast increases O2 to brain, increases HR and BP when needed, shuts down metabolic processes in stressful events to preserve energy. Serotonin plays large role in mood, sleep, wakefulness, and eating behaviors. GABA plus glutamate, these two are the most plentiful neurotransmitters in the brain. GABA produces an inhibitory postsynaptic potential. It decreases the likelihood that a neuron will fire an action potential. Inhibitory equal allows for us to stay calm, not overwhelm ourselves. Glutamate produces an excitatory postsynaptic potential. It increases the likelihood that a neuron will fire an action potential. Excitatory equal contributes to learning plus memory.
Autonomic Nervous System drugs. Autonomic Nervous System, ANS, regulates involuntary functions including heart rate, respiratory rate, and digestion by balancing sympathetic nervous system, SNS, and parasympathetic nervous system, PNS. Cholinergic drugs. Promotes action of neurotransmitter acetylcholine, ACH, równa się increase in ACH. Stimulates PNS, rest relaxation. Cholinergic agonist. Mechanism of action, MOA, stimulates cholinergic receptors, mimics action of ACH, allows body to rest relax. Produces these effects, salivation, bradycardia, dilated blood vessels, constriction of bronchioles, increased GI activity, increased contraction of bladder muscles, and constriction of pupils used for weak bladder, abdominal distension, constriction of pupils, high eye pressure, and hypofunction of salivary gland. Side effects, nausea, vomiting, diarrhea, blurred vision, bradycardia, hypertension, SOB, urinary frequency, increased salivation, diaphoresis, corneal clouding, abdominal pain, cramps, and flushing. Rarely administered B4, in route due to immediate breakdown by Y cholinesterase and due to potential of cholinergic crisis, extreme muscle weakness plus possible paralysis of respiratory muscles. Anticholinesterase drugs. MOA, normally, is broken down by the enzyme acetylcholinesterase. By destroying this enzyme, more accumulates, allows body to rest and relax. Used to decrease eye pressure, increase bladder tone, improve peristalsis, promote contraction in myasthenia gravis, diagnose myasthenia gravis, and temporarily improve dementia. Side effects: arrhythmias, seizures, headache, anorexia, pruritus, urinary frequency, induction of preterm labor. Build-up of can precipitate cholinergic crisis, abdominal cramps, pupillary meiosis, hypertension, increased secretions, salivation, perspiration, bronchospasm, bradycardia. When quick effect is needed equals use 4, root.
Anticholinergic drugs, also known as cholinergic blockers, interrupt PNS impulses, prevent ACH from stimulating cholinergic receptors equals decrease in ACH. MOA, competitively inhibits the action of ACH. Used to treat nausea, treat Parkinson's, relax the GI and GU system, manage headaches, dilate the lungs, dilate the eye, and increase heart rate. Side effects: dry mouth, dry eyes, dry nasal passage, blurred vision, urinary hesitancy or retention, constipation, tachycardia. Contraindicated in narrow-angle glaucoma, hemorrhage, tachycardia, and myasthenia gravis.
Adrenergic drugs, also called sympathomimetic drugs, produce effects similar to SNS, fight or flight equals increase in norepinephrine. MOA, direct-acting adrenergic equal the drug directly stimulates adrenergic receptors. Indirect-acting adrenergic equal drug stimulates the release of norepinephrine from nerve endings. Receptor sites. Alpha-1 adrenergic receptors equal cause vasoconstriction, papillary dilation, closure of sphincter and bladder. Alpha-2 adrenergic receptors equal cause decreased SNS activity, reduced NE release, insulin release. Beta-1 adrenergic receptors equal located in heart, cause increased HR and increased force of contraction. Beta-2 adrenergic receptors equal cause vasodilation, bronchodilation, increased release of glucagon dopamine receptors. Catecholamines, primarily direct-acting adrenergics, produce these effects: constrict blood vessels, increase heart rate, increase blood pressure, and dilate bronchi. Catecholamines are positive inotropes, make heart contract more forcefully, and positive chronotropes, make heartbeat faster. These drugs aren't taken PO due to quick destruction by digestive enzymes. Side effects: dry mouth, stimulation, appetite suppression, increased HR, bronchodilation, decreased blood flow to GI, pupil dilation, increased glucose levels. Contraindicated, uncorrected tachyarrhea. Non-catecholamines can be direct-acting, indirect acing, or dual-acting. Produce these effects: local or systemic vessel constriction, nasal, eye decongestion, dilation of bronchi, and smooth muscle relaxation. Can be taken orally and have longer half-life. Contraindicated, monoamine oxidase inhibitors can cause severe hypertension. Tricyclic antidepressants can cause hypertension plus arrhythmias. Side effects: headache, irritability, trembling, seizures, hypertension, palpitations, tachycardia, arrhythmias, flushing, angina.
Adrenergic blocking drugs, also called sympatholytic drugs, block the effects of SNS equal decrease in NE. Alpha adrenergic blockers at alpha blockers interrupts action of epinephrine and NE at alpha receptors. MOA blocks the synthesis, storage, release, reuptake of NE, or the drug will antagonize ENE or adrenergic drug at alpha receptor site. Produces relaxed, dilated blood vessels, decreased BP. Side effects: orthostatic hypotension, reflex tachycardia, nasal congestion. Beta adrenergic blocks, beta blockers. Selective beta blockers affect just beta-1 adrenergic sites. Non-selective beta blockers affect both beta-1 and beta-2 adrenergic sites. MOA, a drug will occupy beta receptor site equal prevents NE or E from occupying the site equal decrease in SNS. Used for HTN, arrhythmias, angina, narrow-angle glaucoma. Side effects are hypotension, bradycardia, bronchospasm.